Welcome to our podcast, Psychiatric Services from Pages to Practice. In this podcast, we highlight new research or columns published this month in the journal Psychiatric Services. I'm Lisa Dixon, editor of Psychiatric Services, and I'm here with podcast editor and my co-host, Josh Berezin. Hi, Josh.
Hi, Lisa.
Today, we're going to talk about a really interesting article focused on changes in the availability of mental health services delivered in Spanish across the nation.
We're very fortunate to have Dr. George Pro, who is an assistant professor in the College of Public Health at the University of Arkansas for Medical Sciences, here to talk to us about his paper, National Trends in Mental Health Treatment Offered in Spanish, State Differences by Hispanic Population Density. So, Dr. Pro, thank you so much for joining us.
Great to be here. Thank you.
So how did you land in this area of research?
I've studied kind of mental health services and substance abuse services, or more broadly, behavioral health services, probably for the past 4 or 5 years as part of my doctoral training, postdoc, and now professorship at the university. Interested in kind of different kind of epidemiologic trends in how services are, kind of starting with like access. Are the services even available? And then a second piece of my research addresses that we don't address in this paper, but okay, when services are available, are they used? And then the next piece down that line is, well, when they're used, are there disparities in the outcomes of people who use them? So this paper is very much about access to mental health services, in particular targeting a specific population of Hispanic individuals and those who speak Spanish, and trying to identify if there's just first and foremost trying to document and measure how services in the Spanish language are changing over time.
So just to set the stage, one thing that I really appreciated about the background is just putting some context around the demographics of this issue. And there's sort of some striking numbers that you mentioned in there. So can you set the stage for our listeners? Like what are the demographic challenges and what we sort of basically know about service utilization among this population?
Very generally, the Hispanic population is growing in every state across the U.S. It's growing at different rates by state, but increasing nevertheless in each state. And so we wanted to juxtapose that trend and just the growth of the overall population with the types of services that are available specifically tailored for that group, particularly either Hispanic or people who speak Spanish. In Arkansas, for example, from between 2016 and 2020, we went from 2.9 million Hispanic individuals to 3.0, which doesn't sound like a lot, but it's a 9% increase, which is higher than the national average. That rate of change is different by state. And in the paper, we point out, just as a case example in the paper, the state of North Dakota, which has a relatively small Hispanic population, but the rate of growth over time is faster than every other state. And that's another piece that we really want to focus on, is not necessarily the current population in terms of the sheer size, but the rate of change of the population over time. So you may have some states like California, New Mexico, Arizona have really big Hispanic populations, but the rate of change isn't very steep. Whereas you have other states like North Dakota, South Dakota, Arkansas, where the overall population isn't very big compared to other states, but the rate of change and growth in the Hispanic population is a lot faster. And so that's we want to kind of think about those trends by states as we start to then look at health services and what's available and how can we document and measure, what's happening in the mental health world.
That's the demographic trend. What's the trend in terms of service utilization?
Across the board, for all groups or most groups in the US, mental health service utilization is very low. And we see that people who have either a perceived need for treatment or meet some criteria for a diagnosis for need for treatment, we see very low rates of healthcare use. And there's different populations have different barriers or experience different burdens to healthcare utilization, but it's low across the board. In the paper, we point out that in that environment, it's disproportionately even lower among Hispanic populations.
When you say low, can you put a number on that or a percentage on that so people understand kind of what universe we're in here?
Yeah, it depends on the diagnosis and the population, but in general, it's as low as in the single digits for some mental health diagnoses, up into maybe the 20s or 30s for others. But I'm confident that we don't get up to that, even the 50% threshold for most diagnoses for most populations. It's very low for most age groups, most racial ethnic groups, rural communities. The health disparity populations in general are in that kind of, I would say, single digit, tens, teens percent of people with a need actually get it.
The background is that you have this growing population with, like most groups, a low service utilization. And that's kind of the context of why you're looking at this issue. And why focus on language access? How is that a piece of the puzzle?
That's an immediate response to why we, as a team, thought that would be an important paper to write, to document, and get out there. And then just personal experiences and interest in languages in the world. More immediately, we have a very diverse team of co-authors with backgrounds in health services, EPI, Spanish language, nursing, mental health. And we kind of came together and just started to brainstorm networking here at the university during a pandemic, trying to find people across the aisle, so to speak, with different interests that we could collaborate. And we just kind of all, over time and through discussions, just collaboratively settled on kind of this topic. We all felt that it was important and in a direction that we'd like to continue pursuing if we get kind of generate some interest in this paper.
So could you give us a sense of what you have a very clear research question, I think. And so could you just give our listeners a sense of what you were trying to answer and what data set you used? And then maybe to start off, just sort of the top line result, which you've already alluded to in our conversation already.
Yeah, we started off with a broad research question about how has service provision in Spanish in mental health facilities changed over time? And we started with that and then thought, well, it's also important, this second piece of the actual size and growth of Hispanic populations in those states. Because if you just look at, for example, see one state where not much is changing in terms of Spanish provision and services, it's a little more, you can look more in depth if you also know what's happening in the state. So if you see a skyrocketing Hispanic population and then no change in the facilities that offer Spanish, that's a disparity and that's a problem where we're seeing a demand outpacing the availability of a service. And so we found that in all states, the Hispanic population is growing, and that comes from US Census data. And then using the survey data from this study, that in most states, the proportion of facilities that offer Spanish decreased over time. So we see like a disproportionate growth in upward Hispanic population and downward provision of Spanish in mental health facilities. And that's the main point that we discuss in the paper is, how can we minimize that gap between those two factors?
So George, Josh knows that I get into some of the weeds of the methodology, so I'm going to do that here just for a moment. What is the survey? I'd never heard of it. The National Mental Health Services Survey. Can you talk a little bit about that?
Sure. This is free, publicly available data from SAMHSA. And you can go to the SAMHSA website and download the whole data set and use it, in under a minute. There are roughly, and it's all known specialty mental health facilities in the US. So in the most recent year, or at least in the year that we reported in the paper, it's about 13,000 mental health facilities across the US. There's also a sister data set called the National Survey of Substance Abuse Treatment Services. Similar, it's all known specialty substance abuse providers with a similar, very large sample. The treatment episode data set is another example of a SAMHSA data that's free and publicly available for use in research. National Survey of Drug Use and Health. So this is all survey data. It's administrative information, so there's no patient level data. It's more like what kinds of licensure or certification do you have? Do you offer these medications? Do you offer medication for opioid use disorder, et cetera? And there's about 70 or 80 questions that these facilities respond to every year and submit to SAMHSA. Then you have it's annual, cross-sectional, repeated panel data, and you have so every year, and you have it by state as well.
And a very high response rate too.
Yes, so this is, I don't know when the survey is administered exactly what the process is, but I believe it's either over the phone or an online survey, and some key administrative personnel from each facility responds to a series of questions. And it's about 90% response rate of all known mental health facilities. About 90% of them respond to this questionnaire.
So just to put some sort of numbers on it, could you give us the national top line results before we get into some of the state data that you present in some of the figures?
Sure. So again, one piece to orient the readers or the listeners is that this data is all known specialty mental health facilities that offer treatment. And so in 2014, using this survey data, there were about 13,000 facilities total in the US. In 2019, there were 12,300 facilities total. So even without getting into the Spanish piece, we see a decrease of about 700 facilities across the country of specialty mental health providers, or a decrease of about 5%. So overall, the outlook for specialty mental health facilities is not great, and it as we see that decrease. Now, specifically for the facilities that offer Spanish, that went down from about 5,200 facilities to 4,100 facilities, or a decrease of about 18%. So overall, specialty mental health treatment facilities are decreasing in frequency, but the decrease in those that offer Spanish is much faster than the overall decrease. And it's outpacing the decrease of all facilities by a rate of about fourfold. So overall, again, to recap, we see a decrease in all mental health facilities, and then those who offer Spanish are decreasing even faster. And that's where we want to point to this kind of these disparate trends in Spanish services being something of particular interest in the mental health field that we want to address.
So you have two figures in your paper that really like these figures a lot, because you can just look at them and you take them just a minute to sort of get oriented, and then I think you understand your entire paper in sort of two images. It's not good radio to describe them in detail, but sort of like maybe you could tell us what are the take homes from those two things. So I stared at them for 30 seconds and had a take home from each of them right away. So, but I'm interested in hearing how you would describe what you were trying to evoke with both of those figures.
Yeah, exactly what you said. And we want this to be able to stand alone as its own piece of information that perhaps with the title of a paper and a figure, you could get the results pretty quick. And everybody on our team, has an interest in really clear, well-defined figures. And also this can be kind of dry material sometimes. And it's hard to say we like to be creative, but we like to, in our own world, try to be as creative as possible and make really clear, succinct, and not fun figures. That's the wrong word, but we want it to be able to, if somebody actually look at it and just kind of get it, not have to wade through details. And this is a very descriptive study. We're only reporting proportions and percentages. It's not adjusted for anything. We do that, and that's all super important in epidemiologic studies, but you can also convey some really important points with simpler methods. And I think that the simpler that you can kind of convey a point and tell a story, the more effective it will be. We definitely have plans to continue looking at this issue and maybe use some more complex modeling and et cetera. But I think for now, this has kind of reaffirmed that in me that you can do really good, interesting studies with more simple statistics and tell a really comprehensive story about what's happening out there in the world and why should you care and what does it look like. But to describe the figure, again, we want to juxtapose these two key factors: changes in the Hispanic population over time, and then changes in mental health facilities that offer services in Spanish. And so the change in the Hispanic population is what you see in those 5 panels. And those are quintiles, or 10 states each, right? So it's a fifth of all states are in each panel. And you see, as even without looking at anything, you see everything starts to increase as you go up to the right. So we can, without looking at the slopes or angles of any of those lines, we can infer that facilities that offer services in Spanish are more prevalent in states with higher Hispanic populations. And that makes sense that there is some response by the healthcare system to the needs of a growing population. But then as you look closer in each panel, most, I think we reported 44, if not 46 of those states are sloping downward. And the downward slope is much steeper in some states than others. And that's really what the crux of the findings of this paper are all about, that regardless of your current trend in total Hispanic populations, in the vast majority of states, facilities that offer services in Spanish are declining. And that's a problem. If you see a population growing and something that's helping that population getting worse, that's the takeaway from this paper, is that we feel like we were able to fairly efficiently kind of describe those two pieces and put them together and show them in a kind of visually appealing way.
I think your figures are fun. You said they weren't fun. I think they're kind of fun because you really, like, even though it's not, a regression model, like it takes a while to describe what you just did, but you can glance at that figure and in a second, really, and it's also rich information too. Like at first glance, I didn't notice the slopes of the lines. And then when I read the paper, I was like, oh, that's an important detail. So I really want to encourage people, if you have 1 minute and want to understand what's going on with this paper, to look at the two figures in there. I mean, my take home was that, like you said, the higher proportion of Hispanic residents there are in a state, the more services there are, but Spanish language services are declining across all of those and at different rates. So you get 50 states worth of information in one figure. And then you also map that on your second figure and get a sense of the geographic distribution of things as well.
Yeah, and the map is interesting too. And I like these maps. They take a little bit to orient yourself as to what the key means. So this is called a bivariate choropleth map, where you're showing different shades of colors for the intersection of the values of two variables. So you can have anywhere from low to high variable one, or in this case, it's the Hispanic population, and low to high, how fast are the Spanish services changing? And then we use different shades to show kind of where all possible combinations of, can you have fast growth and slow growth on either variable?
So you can just take a glance at the map and see that there's something that's consistent across the Southwest.
Yes. Two key takeaways are kind of the two colors, the two extreme colors. So very light gray and very dark red. And then you mentioned the Southwest. So that's Texas, New Mexico, Arizona, Nevada, and California, and very light gray. So these have a very small change in the percentage of their populations that identify as Hispanic. We also know that these states have some of the highest Spanish speaking and Hispanic populations in the country, but the rate of change is not as fast as in other states. And then they also have a very small change in the proportion of mental health facilities that offer services in Spanish. The key takeaway for this kind of Southwest region is not a lot is changing, right? The Hispanic population is growing at a very steady, slower rate than other states. And the facilities that offer Spanish are not decreasing in any problematic way, but they're also not increasing, which is the ideal for strengthening health systems across the board. But then when you look at the other extreme color in the map with that dark red, these are states with really fast changes in the overall Hispanic population and very fast decreases in the percentage of facilities that offer Spanish. And that's where we really want to focus. And if there are listeners from North Dakota, this is not, just looking at some states, and that's an easy one to describe how to interpret this map. But North Dakota, for example, on this map has a very small population, a Hispanic population, but it's growing very fast. But the percentage of facilities that offer Spanish is also declining very fast. And so that's a problem, that we see population growing in a service that many of the need declining.
It's interesting because, again, the map is wonderful. It's so funny that we're talking about a map on a podcast, but
maybe we'll try to link to them in the program notes so people can have
yeah. But it's interesting to me that another state that looks like it has the same color in the map is Ohio, which is a bigger population, and So in some ways, it's affecting more people, right?
Right. And so when your listeners go for themselves to look at this map, or if they're listening and looking at it along as they're listening, that your point is perfect, that the overall populations in Ohio and North Dakota, for example, are very different, but they're shaded the same color in this map because we're looking at the rate of change, not the overall population. We had fun making this, and we ourselves write many, many papers with tables 1, 2, and 3, and those are super effective. And that's where we are likely headed with this content or this kind of idea. But for more descriptive papers, I really encourage people who are listening that are writing their own papers to think about just interesting ways to visualize it. And a lot of people on my team start with a pen and pencil and paper, and just what would it look like, and can you draw it by hand?
It seems to me that this is useful and interesting, but it also has some limitations in the sense that it's not entirely straightforward how many people are being affected. So you could have a lot of states with very small populations that show this pattern that would still affect a relatively small number of people relative to the whole population. And so it's in some ways it might be interesting to go beyond the percentages within a state and look at the numbers of people.
Yeah, so that's a limitation. And we also don't know where the facilities are in the state and where the Hispanic populations are in the state, if there are concentrations of
Yes.
or groups of people. And so that's another limitation. And so when you start moving up and aggregating up to these state level proportions, you lose a ton of granularity. And this is as granular as this data is and that we used. My experience, the issue is usually, well, national data is more national, but it's less granular and you don't really get what you want. Your local data, you can get exactly what you want and talk about the state of Arkansas all day and where people live and all these cool analyses. But how generalizable it is to the rest of the country becomes, you're less sure of. In fact, it's not generalizable to the rest of the other 49 states. And so we want to be somewhere in the middle where we have some kind of granularity, which is interesting and useful, but big enough that it can apply to people in other states and they can find some value in it.
Well, I'd also say that in your first figure, you do address some of those issues because you're dividing the states up by their Hispanic population. The other thing I'll say about this is that I think of this as something that would be like very easy to present to a policy maker, right? So like they're not going to look through your tables if you're presenting a multivariate model, but they can look at that map and have a sense of what is going on, or your first figure, and say, oh, so we have a mismatch between supply and demand, and those are moving in opposite directions even.
I totally agree. I think this is easier to communicate and describe to people, and that's our goal. I think it's there are multiple audiences that we try to communicate with, and ultimately, I think here in Arkansas, anyway, or just the way that we approach things here in this College of Public Health, is that we want the widest range of people possible to be able to access this research and then understand it and apply it to their own lives. I will admit that the hardest part of, and some listeners may be sympathetic to this, but we often write in these papers about a concluding piece, right? And this should be used to inform policy, period, the end. And it's not really, it's in there and we mean it, but what we do as academics and researchers to actually then use it to communicate with policymakers is something that we could all strengthen and improve on.
So just getting back to your last point about the step after the paper, what are some of the either ideas that you've generated around how to address this issue, or thinking from a research perspective, what are you've alluded to a couple further analyses of these data. So what's next?
We're considering looking at a similar question with the National Survey of Substance Abuse Treatment Services. I mentioned that earlier. It's like a sister data set, but addressing substance use as opposed to mental health, and seeing if there's a difference in Spanish language in realm of substance abuse treatment provision, and then possibly comparing it to these findings if there are differences or in what direction or how strong are the differences. And then locally here in Arkansas, I think we've received some attention from this paper from other people in the College of Public Health. We want to expand our kind of research team and see what kind of new ideas people might have that could inspire or motivate future research projects, looking at documenting and measuring disparities, but also looking at the state of Arkansas and in the South in general about how can we use this evidence as a base of information to make real changes in how we deliver healthcare in the state.
So that seems like a good place to end. And I very much think that you have, in addition to presenting this really crucial information, I think that you've achieved your goals in presenting it in a really accessible way that makes a point very succinctly and very easily in a way that your neighbors can understand. And so definitely encourage all of our listeners to check out the paper to get a look at not only the results, but also how you presented those results as well. So thank you so much for joining us, and we look forward to the next steps.
Awesome. Thanks for having me.
That's it for today. We invite you to visit our website, ps.psychiatryonline.org, to read the article we discussed in this episode, as well as other great research. We also welcome your feedback. Please email us at psjournal@psych.org. I'm Lisa Dixon.
I'm Josh Berezin.
Thank you for listening. We'll talk to you next time.
The views and opinions expressed in this podcast are those of the individual speakers only and do not necessarily represent those of the American Psychiatric Association. The content of this podcast is provided for general information purposes only and does not offer medical or any other type of professional advice. If you're having a medical emergency, please contact your local emergency response number.